Digital health arena. Kind of the reason we're all here today at GoCo, as Michaela said, is because what we're trying to do here is introduce GoCo. Was opened to the public in February 2003, so it's quite a new arena. At that point, there were the founding partners. There were a few, if you want to say, renters that were coming in to establish their companies here, but it wasn't the full ecosystem at that time. So what's really been happening in GoCo then is building capabilities that the community can access an ecosystem. So one of the ideas that I pitched to the founding partners, AstraZeneca's CIO then at the point, was around how can we create this to be a connected environment. My background coming into that is from automotive. So I come looking at telematics and connected vehicles and looking at over-the-air software updates and things like that. Not humans, not patients, but data points. But in that, most of my work has been working with diagnostics of vehicles, how to use digital tools for diagnostics, but very much into the aspects of policy questions around that. So when you can track a car and where it's moving, and you know the owner of the car, what's considered privacy data. So much of that, is similar to the health industry and how we treat data and a lot of the regulatory environments around that. So having that background in automotive, not coming from health, also helped me think about health data in a different context. At CIT, I lead the data-driven innovation area within CIT, which is really around bringing data and moving from what the data means to helping companies and actors utilize data. At CIT, we have an applied AI team, we have an innovation team, but now we're investing more and more into data-related and data innovation activities around that. And then here at GoCo, I'm coordinating what we call the Health Data Innovation Platform, which I'll be talking more specifically about here, but also initiated this concept around building a digital health arena here at GoCo, which can be a place that many can come to collaborate, present, that we can present data, involve researchers, involve businesses to utilize that data in a more dynamic way. So Digital Health Arena at GoCo, from a founding partner perspective, is really around bringing data-driven innovation to the market more quickly and sustainably. Because of the community of actors here being around 80 different life science and healthcare companies that are here, means that there's a lot of knowledge within health, but also a lot of needs between the different healthcare providers here. So bringing in the scientific research aspect to it to address a lot of these business-related needs, because of one of the founding partners being Chalmers University of Technology, means that we can more interactively integrate with these companies and support that away from the university environment and more into a collaborative ecosystem type of environment, which is what the objective is in terms of being able to apply research findings directly into business. And then finally, Western Sweden has been really focused on establishing itself as a leading life science cluster within Europe. So there's lots of investment going on within Western Sweden, not only from AstraZeneca, but other life science clusters around the area. We have leading hospitals, so therefore there's a good environment, a collaborative environment to both be seen internationally as well as in Europe, to take a leading role in that. And here at GoCo, the area that we have here is around 200,000 square meters of space. So it's a very large life science cluster in terms of that. And trying to put some ideas around what we're trying to do here at GoCo is bringing both digital interaction as well as data, as well as capabilities already existing with healthcare into the development of GoCo as a community as more and more buildings are established around the area. Because what's represented in GoCo here is all aspects of the healthcare value chain, you can say. So there's both those that are providing equipment, it's those that are providing care, it's rehabilitation facilities, it's elderly care facilities. So you get a very good miniaturized ecosystem of what society looks like in terms of healthcare needs. So very much around these is trying to bring in more data points and digital aspects to that. And the healthcare data platform is trying to establish a commons, to use the coin that we've been talking about here, is a commons for all these different companies and this 200,000 square meter platform that we're operating within, to develop things that can support both the policy and regulatory aspects that constrain them and guide them, the data that's captured and how it's utilized in the market, but also the innovation processes to facilitate finding new treatments, new technologies that can improve healthcare outcomes. So our project is funded through Advantization, the same as Just Data Labs. We were funded basically starting from around the end of last year, and we're running up until 2026. And right around that time was around the same time that GoCo really was established and that people started moving in. So we've been aligning much of our activities with the growth and the new partners that are coming in. The lab itself is to build a national health data lab, data-driven lab, through the Vinnova call. And our scope is really around setting up the commons, the systematic and standardized way of how health data can be utilized to drive innovation and improve better health outcomes for all the different partners that are here, which is very much what the founding partners want to be able to provide as a service through the infrastructure that GoCo is offering here. So in our project, the main partners that are part of operating in the project, AstraZeneca, GoCo as an organization, because they have a separate, they're responsible for community management. They're responsible for all the events planning, all the restaurants. So they provide the innovation environment we can operate in. Vectura is the property owner that invested in this. They have other life science clusters. So they're also doing Forskaren up in Stockholm. They've also done in Lund another life science cluster. So therefore they see the value of having this common way of approaching health data to apply into other healthcare life science clusters. Västergötlandsregionen, so having both the region with the data, the patient data and other social data, but then also the connection to Sahlgrenska University Hospital as a research hospital and a university hospital. RISE, Håkan and Susanne here from RISE, providing policy guidance and support and all the, if you say, dissemination of the regulations that, and a lot of things are happening in this area in the regulatory space with new regulations coming that need to be interpreted. So therefore, it's a very dynamic and fluid environment around regulatory questions within the healthcare space. Chalmers University of Technology, there it's the health engineering department, the ones that are driving both application and development of healthcare technologies, medtech, things like that. AI Sweden, looking at the techniques for privacy protection. Gothenburg University, which has the Swedish National Data Service. So they're doing a lot of the social data connection labs connected to Corona and COVID, for instance. So there's a lot of research on how do we make more public data available through that. And then Chalmers Industry Technique as a coordinating partner with that. And within this community, the other founders, which we've seen from this initiative, has already been added to it, is Fujiriba Diagnostics, another company here, as well as Wellspect Healthcare, as well as Munica Healthcare. So some of the main founders see the value and want to drive innovation through making their data available and understand if there's more value from the data than what they had thought themselves. And then also Region Holland has also expressed interest. We've been collaborating with them on a few calls around synthetic data that now are interested in officially joining this program, as well as Halmstad University. So the ecosystem grows when they see the value of solving fundamental problems, which is that if you have 14 different partners, you have 14 different ways to access data. So it's trying to build this standardization and commonization around it. And what we do here at GoCo is around the digital health arena, which is really our communication channel. That's how we drive events like this and other events in order to create engagement with the community and create a one-stop shop for them to be able to understand, here's where we go to engage in digital health related questions. Behind that then is establishing these elaboration environments, a lab for policy questions, as some want to understand what does this mean for me in terms of an AI Act, in terms of a European Health Data Space Act, what does that mean for me as an organization? And then also looking at the data lab itself. So what data is utilized, how do we build common ontologies for the data, how do we use and apply AI in a proper way for that? And then finally, innovation being more about the process. How do we actually help facilitate the exploration process and ideation process around this? So these are some of the common tools that we're developing here within GoCo context. And to kind of lay the strategy as we've been working here at GoCo with them is starting with the process, the commons around how we work, but then adding on to it infrastructure, because once you have a common process, you need to have common technologies that will access things. So there we're looking at trusted research environments. So how do we share data between different organizations in a safe, transparent, and trusted way? And then finally building frameworks of how this as a community here can implement new technologies into that infrastructure and into those companies through the processes. So therefore, we look at things like how AI is developed and AI regulatory sandboxes, which is mandated by the AI Act. How can we support them in that? Where we collaborate with other partners around just the establishment and identification of what an AI regulatory framework actually requires. So our step one here in kind of laying the foundation of the processes, is really working through engaging the ecosystem and understand the current state, how they work with data today, what's the data that they're using, what are the processes and the tools of how they're extracting data, so that we can at least build up a standardized way in order to gather all this base information for these different organizations. So as a new company enters into GoCo, we know how to enable them into this data community that we're building. And then the second area that is defining what services then are needed. So based on understanding how they work with data, what they want to do with the data, how do we build services then that are going to support them and support many others as we introduce them? So those are the two main aspects of the project that we're doing here for building the health data innovation platform. And what it really ends up being in these different building blocks is using a lab environment where we can have cross collaboration between different partners to provide guidance for them, more as a facilitation activity, not so much as as saying this is a tool to use, this is a platform to use, but helping them explore the questions so that we as a platform also understand new questions and new perspectives that we can integrate into the further research going on. And from a data perspective, a lot of it, and that's where I've interacted both with Michaela around knowledge graphs and the use of able to express ontologies and build common models where you have different definitions between different organizations of how the same data has been interpreted and implemented. So that's going to be a big area as well, is utilization of knowledge graphs and communication of knowledge graphs to help other partners know how to map into the data sharing systems that we're trying to establish here. And then finally, the innovation lab, really being around how to utilize technology to support them in getting more value from their data. And helping them then through the digital health arena communicate all the innovation that they're achieving through that. And for us, as a final picture then, is much of this is around an agnostic picture of how to drive data innovation. Because coming from automotive and not having worked in healthcare, these are the same methods and tools of how I've worked with diagnosing problems in a vehicle to how to work with diagnosing problems in a patient. So what we're trying to do here is be able to bring standardized models that help cross industries integrate and share data more dynamically between them, so that a Volvo car company can share with Sahlgrenska University data that can unlock new value for them, both as organizations. And the new applications that we see for this data-driven innovation platform area, then, is looking at the same as we see in healthcare is sustainable materials. So how are textiles utilized? Healthcare is a lot of single use. Other industries are after reusability. So they're introducing new ways of looking at both classification models for medical equipments can help support increased recyclability and reusability of it. So there we do projects that we apply for additional capabilities that help us explore other areas and side streams from healthcare, like the materials, like the medicines, plastics, medical equipment that can utilize data in a different way for different value. So that was all I had from me for my 20 minutes. So, yeah.